Hello, friends, and welcome to episode 9 of Conversations with Dr. Westman. So, how are you, Eric?
Good. How are you going?
Very good, thank you. Today, we're going to be chatting about is low carb different for men and women? So, I wanted to ask when treating metabolic type of illnesses, type 2 diabetes, hypertension, is there a difference between men and women in terms of the diet being able to be effective?
Yes, I think so. And it's kind of complicated. I mean, or let me rephrase that. How I look at the food or teach the program is not so different. Like if I'm going to do a keto, low carb for metabolism fixing, so like for diabetes, things like that, the teaching that I use is pretty much the same. I mean, there'll be some nuances, like, for example, a young woman with PCOS. So, these really have to do with hormonal issues, right? Main difference between men and women are the hormonal fluctuations, often monthly. So, kind of a classic example, a young woman with polycystic ovary syndrome. It's a condition caused by carbs, by the carbs being changing the hormones, insulin being the mediator, so that there's more testosterone in the female body. So there's more hair growth. The periods might be stopped. Menstrual cycle periods might be stopped. So in that case, a young person uh, might have to be stricter in terms of the carbs that they can eat compared to, say, someone who doesn't have PCOS. They're the same age and they just want to lose weight. So, so I guess if there are some specific syndromes that are gender specific to women, they may have to be stricter on the diet. But if I'm going to teach the strict, 20-gram keto approach, it's pretty much the same.
And what about for weight loss? Because I've heard you sometimes mention that for men, it's either easier or they lose the weight quicker than women. How about for weight loss? How does that affect things?
Well, so that gets into the if someone what the experience is on the low carb keto diet. The experience can be very different for women than men, and the weight loss, the amount of weight loss, the speed of weight loss is a big factor, especially among a couple, a man and a woman the man is losing weight faster. They're doing pretty much the same thing. So in general, women will lose weight less fast, less rapid than men. And I don't really understand why that is. Uh, Again, that's one of those studies that we love to do to figure out if there's some way we can manipulate that but at the moment, I just reassure people that it's going to be maybe a little slower. So the experience of the weight loss is different in general for women. It can be a little slower. So don't compare yourself to what you see. Uh, to, um, and of course, don't compare yourself to the average social media person showing their great results. In the clinic, I expect 1 or 2 pounds of weight loss per week. So that's pretty big range. That's 4 to 8 pounds per month,
For women,
and
Eric? For women.
for men and women, yeah. And we did a preliminary analysis of our data in our clinics, and yes, the men lose lost more weight on average than women as well. And that was adjusting for the fact, accounting for the fact that men were heavier to begin with. I mean, that's another thing to keep. If you are going to compare yourself to other people, and you're smaller, you're not as tall, and you have less weight, you're going to be losing weight at a slower uh, amount per week than the people who are larger than you, heavier than you. So again, a lot of work we do in the clinic is to just reassure people that what they're experiencing is within the realm of what we typically see. I say a lot of you're right on track. You're on track between that 1 to 2 pounds per week. if you're doing this for weight loss.
And then there's obviously a pre and post menopausal woman. Does this make a difference? Do hormones play a big role in the weight management?
Yes, definitely. What we've learned is that, and this is based on clinical experience, not any formal study that I can point to, but the changes that happen with menopause make it harder for women to lose weight with any approach, actually, that they try, including a keto approach. Um, One of my teachers, Jackie Eberstein, who worked with Dr. Atkins for 30 years, is female, and she uh, explains in lots of different lectures. You might be able to search these on YouTube about women's health and low carb keto diets. In her experience, the women have to be even stricter, maybe even 10 or 15 carbs per day. That's total carbs. If you're just going to have the carb restriction be what you're doing. So you may have to be more restrictive than a younger premenopausal woman would be.
So now we're on the, while we're on the topic of hormones, how about leptin sensitivity for men and women? It's often argued that women are more sensitive to this hormone.
Yeah, I don't know a whole lot about that, and we're at that early stage of research where we may have theoretical reasoning, or we might have one or two studies. That's kind of like, to me, early precincts in an election. It's like the beginning of an election without a full view of the information. But I guess the bottom line for me is, can I use that information clinically? Um, it seems to me leptin resistance typically goes along with insulin resistance, and these phenomena get better as you do a keto diet, and especially if you have weight to lose weight on a keto diet as well. But I don't know a whole lot about the gender differences for leptin sensitivity.
And before I get on to some of the questions people have asked, are there any other differences that you're aware of when people embark on this type of a program for men or women, other than what we've mentioned?
Well, the hormone fluctuations, the menstrual cycles, can bring in cravings and kind of odd things that men don't have to go through, and so I guess it's kind of a stereotype, but I make sure that people know how to get chocolate in a safe, low carb way. It's one of those things that any successful long-term lifestyle approach has to deal with. How do you get people chocolate? And so we talk about how you handle cravings and make sure you're choosing sugar-free things. In our area, you can buy these low carb, high protein chocolate shakes. And I explain that you don't use these chocolate shakes like a meal replacement. People will glug down the whole carton of it. What you want to do is just use it as a chocolate replacement, so that have one or two swigs, you put it back in the refrigerator, you're minimizing the carbs that you're having, and you're still getting the chocolate. I do help people figure out how to handle different sorts of cravings that they might get. The other, hormonal issues, because of different types of contraception. If there is a hormonal-based contraception, this can interfere with weight loss, even cause weight gain if it's one of these depot, long-acting contraceptive shots. Often people don't think about the birth control or contraception as being a possible reason for something not working or not working so well. But the main thing, you can see it when you come to our office, that the average person who comes to my clinic seeking medical support for this is about a 65-year-old female. In our area, the BMI, or body mass index, on average is about 35, normal being under 25. And so that just kind of shows that if there's a certain time period in someone's life where they seek out more help, it's the postmenopausal woman
As
because of
always,
metabolism.
As always, Eric, thank you so much for the information. I'm sure that some people will find this very, very valuable. I've got a couple of questions, as I said. And first question we have is from Bev. And she asks, talking about menstrual cycles, just before my menstrual cycle, I find that I'm hungrier than usual, as well as my cycle is very heavy. Is this normal? So two questions there. Hungrier than usual, and the cycle is very heavy. Do you typically see this in your clinic?
Well, I'll see lots of different changes. So I'm assuming that she's already started a keto or low carb diet. And so some people will actually have periods, menstrual cycles come back, especially in the condition of PCOS or polycystic ovary syndrome. So you need to be careful that if you haven't been if you don't want to have a child and you're actively having sexual relations, then you want to be careful and have contraception. Even though you might not believe you can get pregnant, within a month or so, the menstrual cycles can change and the ovulation can come back and you can actually get pregnant. So we let people know that. I wouldn't say it's typical though to have more flow, but I hear lots of different things. Early on, there are a lot of adaptations that take place. So if it's not, to the level of medically worrisome excessive menstrual flow, just stay with what you're doing and it will probably regulate out, change back to more normal for you over the next few months. As far as hunger being worse, I think that's, I hear all sorts of different places, times, situations when people get hungry. We recommend that you do eat from the allowed list of foods when you do have hunger. Just stay away from sugar. And if it is a chocolate craving, of course, figure out a way to get chocolate in a low carb,
And a
keto
DAP
friendly.
bar. And a DAP bar.
Oh, I forgot about ADAPT bars. ADAPT bars are fantastic.
Right. Okay. We've got another one here from Brenda, and she says, a few of us have been on a low carb diet for quite some time. Only my female friends seem to be having trouble sleeping. Is this something that typically affects women on a low carb diet? That's quite an unusual one, sleeping, and that affects women. Have you ever heard of that?
Well, that's interesting. Yes, I've heard some people have changes. Most of the time, it's to have better sleep and more restful sleep, although it might be less hours of sleep. So don't confuse the number of hours with how restful it is. You may have less sleep, but more thorough restorative sleep is the term I was looking for. I don't, again, without a formal study, there's no strong signal for me clinically to think that it happens in women more than men, but I'll certainly pay more attention to that. But the whole issue of sleep in our studies that we've done, a expert in narcolepsy came to us, a Duke professor, and narcolepsy is a situation where you fall asleep during the day. You might even fall asleep when you're driving a car, and it could be a serious issue like that. And the narcolepsy improved on a low carb keto diet. That's a publication probably, I think 2008, some years ago. But I'll have to listen more carefully or encourage studies with looking for male-female differences in terms of sleep.
Eric, typically at your clinic, you've been doing this for about, what, 14, 15 years at your clinic at Duke University. You've
Yes.
probably treated, I think we've discussed this, over 10,000 people. You've obviously treated men, you've treated women. At the end of the day, just in closing here, what sort of success rate do you see in your clinic?
Well, I've become more confident in my description of what can happen, and I think that helps. If someone follows the list of foods that we give. Because so many studies have been done, I'll say, if you follow this, it will work like a prescription drug. And then, of course, I want to make sure people come back and they're truly following it. It it really is 100% that if someone's truly following this and there isn't some extraneous medication, social factor, the habit eating, all that, and those are things we work out with people over time. Pretty much everyone can make this work, and now it doesn't mean they stay on it for forever. And we work hard to help people stay on it for the long term. In our experience, in our clinic, remember, if someone comes to me for a clinic, that means they've sought out help. And there are a lot of people who just do it on their own. They don't need my help, or they've watched one of our videos and they just do it on their own, which is fantastic. So the selection bias I get, or the type of person I get, is someone who seeks out help to do it. At about a year in the surveys we've done, about 50% of the folks are still doing it and having success with weight loss. And that's about what you expect with any other sort of clinical lifestyle or medical program for weight loss. No program is perfect. And I don't say that this is going to work for everyone who learns it in a haphazard or Dr. Google way. But if you really take the time to learn it, or just follow the simple rules that we lay out, yeah, it really is very effective, like a prescription drug. I wouldn't, if you had an infection, sinusitis, and I wouldn't say, if you go out and buy this expensive prescription drug, it might work, it might not. Are you going to go out and get it? So don't confuse, the diet, does it work or not? Yeah, it works.
Fantastic.
But you have to do it.
Eric, thank you so much for all this information again. And for all of you guys watching, if you enjoyed this video and you would like to see future videos, as always, please find us on our YouTube, Facebook, Instagram, and Twitter account under the name of Adapt Your Life. And if you are subscribed on our YouTube channel, please be sure to click the notification bell to be alerted the next time we post one of these videos. And if you enjoyed the video, like I said, if you would share or give it a like, that would mean the absolute world to us. So that is Dr. Westman and myself signing off for Conversations with Dr. Westman. Next week, we're going to be chatting about, is a low-carb diet for everyone? So on behalf of Dr. Westman and myself, this is us signing off until next week. Thank you so much, Eric. Thank you.
Thank you, Glenn.